with a great pleasure and profound gratitude that I welcome you all to the inaugural Neuro Bharat Conclave today, which marks the beginning of a remarkable journey dedicated to the advancement of neurosurgical and neurosurgical sciences and the enhancement of the patient care. Today, we are going to witness the first live operative workshop of Eastern UP with a special thanks to the Dr. S.K. Poddar sir, the President Varanasi Neurological Society, with the organizing chairperson Dr. Rakesh Kumar Singh and Dr. Avinash Chandra Singh for making this event a success.
काशी में पहली बार ऐसा न्यूरोसर्जन और जो हमें बताया गया कि न्यूरोसर्जन न्यूरोलॉजी दोनों के मिलाकर के पहली बार एक कॉन्क्लेव हो रहा है। हमें विश्वास है कि इस कॉन्क्लेव से कुछ नई चीजें निकलेगी। जो नई चीजें निकलेगी वो 140 करोड़ जनता के लिए लाभदायक होगी।
Welcome you here on this Bharat Neuro Conclave. Really, it is a wonderful conclave. It is like a Samudra Manthan where lot of things will come out, and that will be very helpful for the management of the patients of neurosurgery as well as of the neurology.
Our guest faculties have taught the teachers those who are training us. So it's a very big time for Varanasi and its medical fraternity that we are going to hear them, and without taking much time, because there are galaxy of teachers who will be presenting their own original talk. So we will start the ball rolling on with Professor M.M. Mehdi sir, who was my teacher and presently consultant at Delhi and has served as president of many societies, and we will later on hear from him.
Not talk in the hall. Now look at this MRI. One needs to have, here one doesn't need eagle eyes. Just one needs the knowledge of first year anatomy. We can see something here in the right thalamus, the lesion. Then we can see something in the brainstem. Here, sorry, the pointer is not there.
This is a subset of patients which usually come to our orthopedic colleagues, which is a hemivertebra, a child who was born with a vertebra like that. And their scoliosis escalates very quickly. So it's extremely important to do a timely surgery, do a correction, and you can get that patient back into his normal, you can say, spinal alignment pretty much immediately after surgery.
And then you have the simple device which you all have in your setting, and that is the cautery. One of the best cauteries that I have used is the Vesalius cautery, but I believe that all cauteries have this function which has the cutting mode in it. So the granules which are low grade specifically, they are having lot of water content. Every day the thrombolysis is changing. So every day, every 3 months there is a new indication, and that's what we are going to see. So basically there are certain very set contraindications where you cannot thrombolyze. If you thrombolyze, you land up into complications. On the other hand, you have definite indications where you should not miss out on thrombolysis. But there are a lot of grey zones in between where you have trouble, and that's where I'm going to talk about all these grey zones and how we should approach them.
It will be blood beneath the dura and the arachnoid, that is what we normally consider as a subdural hematoma. Outside is extradural, below the dura is subdural. Radiologists will call it as a chronic subdural hematoma. If it is hypotense, concave or convex on CT scan, that is what our understanding is. Pathologists will only label it if there is signs of inflammation and infection, not otherwise. That is what pathologist's definition. And for a neurosurgeon, if you make bar hole and there is a free flow of the fluid, we call it as a chronic subdural hematoma. So different people are calling chronic subdural hematoma with a different name.
Where does this APGAR come from? And I actually dug into it. And APGAR was a mnemonic which was formed after it was named after this lady. This lady was a budding surgeon in Columbia University in New York in the 50s. And she was probably one of the first surgical residents who was a female in the surgery department. And the chairman at that time told her that I think it will be better if you look at anesthesia. I think you should go to anesthesia.
So the journey which I started as a medical student was from Bharat Medical College, and subsequently I pursued my neurological understanding of neurological subject in GB Pandal Hospital. So then, until at this time in the mid-90s, the stroke was seen in a very nihilistic way. And I think what we were able to offer to the patient was just the preventive aspect of the integrated drugs and the physiotherapy.
Endoscope controlled surgery, maybe throwing free hole or endonasal surgery or endocrine surgery.